So I'm going to talk to you about how to avoid medical malpractice. I've been an expert witness in over 100 cases, so you see trends and I can help you avoid the pitfalls. Number one seems really simple, but hard to do. Practice good medicine. You have to do a good job with every single patient you see over 45 years. Really tough because you're going to feel tired and crabby or sick. If you're sick, take time off. It's not an excuse. It's like if the pilot came on and said, gee, I'm sorry, we're going to have to ditch over the ocean. I've got the flu. If you're not feeling well, don't go into work. It's not an excuse. Talk to the patients. Really let them talk. Don't interrupt them. And then at the end of your examination, say, so did we get through all the things you wanted to talk about today? And tell me what you think about happening today so they can repeat it back to you. Another thing is be nice to people. It's just as easy to be nice as to be nasty. They're going to sue you if you're nasty. It's true, about bedside manner. Apologize. If you've made a mistake, say, I'm really sorry and I'll make this better. I'm going to change the system so we can fix it and it won't happen again. Always check with the CMPA before you do that. Always have good follow-up. So if you've missed a cancer on an x-ray, you need to be able to bring the patient in and go through stuff with them and sort of tie the knot with them. Always check your lab and x-ray and specialist notes every weekday. Stay ahead of it. Don't let that in-basket build up. Now, just looking at specific problems, a big one is fever in babies. So any baby up to 6 months with a fever has to have a full septic workup. That's not just a cough or a cold or a virus. That could be something nasty like meningitis or kidney infections. Headache, the vast majority are nothing, just tension headaches. But every once in a while there's a bleed in there or a brain tumor, meningitis, so you want to do a thorough history and physical. Write on the chart that you've checked for neck suppleness, no stiff neck there. Appendicitis is often missed. It can be on the left side instead of the right side with a long appendix. It can be early on with just pain in the middle of the stomach before it tracks down into the right. So you want to get a CAT scan of their abdomen, even admit them and get surgery to see them if you're not sure. Cancer can often be missed, especially by family doctors. We see pretty minor stuff most of the time, and once in a while a cancer is in there, and it may be very vague, presentation, just weakness. So if you can't figure stuff out, send them to a specialist. Skin cancer. I'm constantly amazed, all these funny little moles that you get as you get older. I'll send them off to a dermatologist and it'll come back skin cancer. So if you're ever worried about a mole, get it biopsied, don't guess. Same with lumps. I once did a case where this woman was just young, she was pregnant, she had a breast lump. The doctor waited until after she had the baby and she ended up dying of breast cancer. So all he had to do was send her to a surgeon. He didn't have to do a mammogram with radiation. So just, if in doubt, punt to a specialist. Also things like compartment syndromes. That's where you get pressure from a blow to a limb, and could be after a cast is applied after a fracture. They have tremendous pain with it. You have to split the cast down to the bare skin on both sides and get the circulation back because it can be permanent. These are bad for the patient, bad for a legal case because they could have a permanent claw hand that doesn't work for the rest of their life. So you can't just give them painkillers. You want to send them up to emerge and get that cast split. Diabetes, foot infections. You can wind up with your leg cut off above the knee. So I always phone the next of kin on a senior or somebody at a nursing home, say, Mom's got an ulcer on her foot, seems minor, but she can wind up with her leg amputated. We have to get on it with antibiotics and get them to a surgeon quickly. And I'll send them to an infectious disease doctor because it's hard to get into surgeons quickly and infectious disease really quickly. Murder. So I once had a case where where I was an expert in this case where this woman said the TV was talking to her, so the doctor sent her off to a psychiatric hospital. She came back and murdered her husband. And the doctor got off because he had nice, good notes, and he was trying to do the right thing with her, and he couldn't force her against her will because she was going there willingly. So they had no case against him, but pretty upsetting for him. Suicide too. Anybody that's suicidal, you want to get them to the emerge, get them help right away, and never ever change a chart. If you've don't go, if you get sued or something happens, a complaint, and you go back and change it, they can tell. If it's a handwritten chart, they have handwriting experts with the ink. They can check the hard drive too, so you don't try to fool them. If you want to make a change in the computer, type in a change and not try to hide it.